What's up? 12:30 yet? 12:30. We're live lunch with the doc. It's Wednesday. Every Wednesday we do this. Obviously, since you've been following us, you watch it, you love it, you need it. So that's why we're back, because we can't repress any more lunch with the docs any Wednesday. So I got Mr. Dr. Jordan. He's one of our brightest stars at Health and Balance. He is my age. Me and him went to school together. We played volleyball together. We were just talking and reminiscing about playing baseball together when we were like 10 years old on first team Nolan at Riddle Field. Pretty awesome. So he is now working at Health and Balance. He's one of the premier doctors there. And so we got him, dragged him like by the foot out the door because he doesn't like being in camera, but that's not true at all.
Camera shy.
He hangs out with Dr. Gary every day, who's like the most camera-friendly human that's ever existed. So he's like, you know, absorbing his, so now he's all excited. But
got the energy.
He's got the full energy. So we're at Rasta Taco downtown. He's never been here. I've eaten here a couple times. Arya's, have you eaten here?
No.
Okay, well, we're excited. Full burrito festival, and we're gonna order and then sit down. So let's go.
Perfect. Let's do it.
Sweet.
And then we want to know, you guys out there, if you've gotten what you've gotten here, if you have been here, tell us what's good. Comment, talk to us, ask Jordan questions. We can get all sorts of fun stuff. So what are we going to be talking about today?
So we're going to talk a little bit about injury prevention as an athlete. I was an athlete all growing up, actually went through a series of injuries that led me to Health and Balance as a teenager. And through that transformation in my life, I got inspired with chiropractic, and now here I am helping you guys. So we're just going to talk a little bit about how to just keep your body healthy. We're going to talk a little bit about just how to be at that upper echelon, how to get your peak performance, just get everything out of your body that you can. And I'll tell you a little bit about my life and how I can help you in the office. So I'm going to take a little look at the menu here. We'll see what my taste buds are craving.
Here it is. So we got tacos, Jamaican jerk chicken, One Love vegan, al pastor, carne asada, Papa Jack, veggie. Oh, I guess they don't even have burritos.
Just tacos.
Did they change? They changed that up. Well,
looks like it's a taco day.
they have
Nothing
Rasta,
better.
They have Rasta bowls, vegan
Ooh.
black beans, Rasta rice, spicy. Alyssa, I was gonna get Alyssa beef and cheese burrito to go, but it doesn't look like it's gonna happen anymore. Taco salad. A Rasta bowl is pretty good.
What's in the Rasta bowl?
Protein, vegan black beans, Rasta rice, whatever that means, spice mixed vegetables, cilantro, cotija cheese, onions, and tortillas and chips. Yeah.
All looks good, yeah. Can't go wrong with al pastor. That's my favorite.
All right, okay, let's do this. How you doing? Good, man. I'm gonna do the Jamaican jerk chicken Rasta bowl. Can I get that to go? We're gonna eat here. I'm gonna. And then whatever this thing got.
Can I get 2 al pastor tacos? Yeah, can I get rice and beans with that too? Okay.
When did you guys stop doing burritos?
So this will be a first for me. I'm pretty excited. Heard a lot of good things about it. So easy walk down from the office after you get treated. Come get a Rasta taco.
Yes.
Make them happy. I think they started last year, right?
Mm-hmm.
That sound right?
I think so. Yeah.
Get a beef and cheese.
And they got this nice little eating zone over here.
Yeah, great little patio.
Before there was nothing, so it's nice.
Yeah. Add
Brighten
a little
up the
bit to
town.
the community.
Yeah.
Absolutely.
Tacos for here.
That'd be great. We got a few adult beverages too.
Nice. Desserts. Good stuff.
Good stuff.
So we are Health and Balance, integrative medicine, just up the street from here. We do every Wednesday at lunch with the doctor. So we try and feature like a local restaurant,
Right on.
And then kind of just like bump it up on Facebook Live, and then we like talk about I don't know. Right today we're talking about like injury prevention and performance in sports. Like last week we talked about stem cells. The week before that we talked about cancer prevention. So we just like pop around Laguna and kind of it's like a community thing, you know, try to get people involved and then like provide really good information for.
Great.
Yeah.
Where can I plug in at?
Health and balance.
Health and balance.
Health and balance. Yeah.
Or just come walk. Where
You can see yourself on
We're right across the
yeah.
street from the library downtown.
Oh, okay.
So my dad started 30 years ago.
Okay.
Yeah.
Gotcha.
So now he's like grown and he's like expanded in this integrative like practice. He has like a medical doctor on board, a nurse practitioner, PTs. Dr. Jordan's one of the chiropractors there. He went to school with me, so like he got trained by my dad in high school, and then he was like, "This is amazing," and then he became a chiropractor.
Come full
And
circle.
my dad's
Yeah.
like, "If you go to chiropractic school, I'll give you a job when you get back." So that's exactly what happened.
That's exactly what
So
happened. Now I'm here.
Now he's talking about.
Yeah, just injury prevention with sports. As an athlete, had some injuries, and that's what brought me to chiropractic. So, talk a little bit about that, just how to get you working at your best you can be.
Perfect.
So,
Yeah.
Yeah. I need to get outside, exercise a little bit. I know that's the best way to prevent,
definitely
body.
stabilization.
In here, maybe tacos.
You can do planks or push-ups just in between taco making.
Yeah.
So I'll do. So for the bowl, the tacos is 18.
Okay, cool.
Yeah. And then the burrito is like 7.
Okay, cool. Melissa's just craving beef.
You just joined in with us. We're here at Rasta Taco. Jordan and Raya.
Yeah. Yeah, George.
And my dad is an orthopedic.
Oh, really?
So I know a little bit of the jargon or whatever it's called, but
Sure. Where does he practice? In Orange. So you grew up in Orange?
yeah.
Cool. Now you live
We've been going down to Victoria Beach, wherever.
Oh, really? You play any beach volleyball down there?
Yeah, we did a training a couple times.
Oh, really?
Yeah. I have done a few minutes, 4 minutes.
Oh, really?
Yeah.
Oh, cool. Yeah. Me and him both played volleyball in high
Yeah.
school. We've been trying to play beach for like a year now. It's never.
Yeah, never linked up.
You guys want to get a game? I'm actually going to be moving like right at nice place.
Oh, cool.
So I'm trying to get out on the court a little bit more.
Oh, cool. Well, then, yeah. I'm trying to get a crew of guys together. I sprained my ankle, so his stuff I'm actually going to be taking hard and like.
Yeah,
today.
we're gonna help.
But once
help
that
Ryan out
happens,
today.
yeah, we'll get that going.
All right, we'll fire these up for you.
Thanks,
All right,
guys.
thank you.
Does that work?
Here.
Yeah. Perfect.
How cool is that? Yeah. Now we just made like a freaking.
Made another friend, another person to play volleyball with, and get to hang out in this great courtyard.
Awesome.
Oh, you just get to make
Pretty beautiful.
connections.
Yeah.
Me and Jordan have been trying to play beach volleyball for like a long time now.
I have a family, so sometimes I get tied up, but we'll link up one of these days. Like Raya said, I used to be a volleyball player. I played all through high school, played a little bit at UC Santa Cruz, and that's kind of what turned me on to chiropractic was when I was in high school, I went through a series of ankle injuries where it seemed like almost I would just recover from one, and then I'd end up spraining the same ankle again. It
Was that
almost-
volleyball?
It was always in volleyball, yeah. I would, they'd land on people's feet as they'd come under the net, or just as I was a middle blocker, I was running, moving a lot, I would kind of just tweak my ankle a little bit. I never felt like it was strong and stable. Always kind of re-injured in the same spot. I would do medical route. I would kind of go. They would maybe take an x-ray when it was severe, say, okay, it just looks like an ankle sprain, wear a boot for about 6 weeks, and then you should be good. No rehab, nothing like that. So,
Wow.
yeah, I would never
wear a
heal.
boot?
Just wear a boot, stabilize it, and good luck. Here's some Tylenol if you need it, and that was about it. So, probably like my 5th round of this, I ended up spraining it, and I think you were right there. Dr. G was on the sidelines, kind of. You were like, you got to go down, see my dad. I was like, okay, anything, like, I'm injured, we were in the middle of the season.
Just don't
It was
put me in
like,
a boot again.
yeah, don't put me in a boot. I got to get back playing. Like,
Yeah.
I think it was junior year of high school that happened, and went down the hill, literally we're right down the street from the high school. I was able to just get shuttled down the hill. Dr. Gary saw me immediately, put some ice on it. He used some laser therapy. He gave me some nutrition to go with it. He actually adjusted my ankle right then. And then we kind of started the healing process. I went through kind of a series of treatments with Dr. Gary. In about 2 weeks, I was actually back playing, which was insane for me because I'd been used to this 4 or 6 weeks. Okay, I'm starting to feel better. But I started...
Are you Dr. Gary?
I'm Dr. Jordan, yeah.
Just keep it down a little bit. I understand you're making some kind of commercial or whatever, but trying to relax on a break. I am. I'm on my break.
Yeah. Okay, sorry about that. So, yeah, I went through kind of 2 weeks. I started playing again. It was amazing for me to have that rehab, that recovery. Then I kind of started doing exercises, started stabilizing my ankle. And to this day, I have not had an ankle sprain. My body has now been able to correct itself. We have healed that area that I no longer, even when I kind of feel it roll, my body can self-correct itself now and stabilize itself, that I don't actually get that full ankle sprain. So that was kind of the start of my journey in chiropractic. And then I had some lower back pain too, due to a genetic anomaly I have, which is just from birth. I had actually an extra vertebrae in my spine. And
Really?
I did, yeah.
Oh, no way.
That last vertebrae was, it's movable, so it shouldn't be movable. So I had a little bit of lower back pain, and Gary helped me out with that. And I was
like a partial spina bifida in my low back.
partial spina bifida, yeah. I have one too.
Fully. Oh, really?
Yeah, partial spina bifida. Have those moms take their folic acid when they're pregnant.
Really?
Heal that spinal cord.
Oh, interesting.
So yeah, then he helped me out through that, and I kind of got inspired. I went off to UC Santa Cruz, played volleyball for a little bit, did psychology was my major with emphasis in biology, and I kind of got out and talked to Dr. Gary a little bit, and inspired me to go back to chiropractic school a couple years later, and went through the program and said, hey, Dr. Jordan, I got you a job when you come back. So here I am working for Dr. Gary and living the dream and come full circle, and so excited to be back in the town I grew up in and starting a family of my own. So that's kind of my overall, history, just kind of life story there as far as why I'm so passionate about what I do and why I came back to here to help you guys out. And I just want to give you guys a little tips today on what you can do to have injury prevention, or if you have injuries, what you can do to start rehabbing those injuries and how to make it so you don't get these same injuries again in the future. Because especially with you just had an ankle sprain, it's disabling at times. It's frustrating. You wanna get out there, you want to do the things you want to do, but your body's not ready yet.
Yeah.
And we were talking yesterday. You're like, I want to, swell's pumping today. I want to get out there and surf, but I don't feel like my ankle's ready yet.
I know. Just a couple of weeks ago, I was playing basketball. So yeah, we all want to be active and do the things that we love to do, but injuries are like always gonna come, right? It's like pretty common, but at the same time, you can take steps to make sure that doesn't happen.
Absolutely, yeah. You can be proactive about making sure that your body's warm, that you're ready to do the things you're doing, and then you're not just jumping straight into it with really tight muscles or with cold muscles that are then gonna maybe tear as you push the limits. So that's a big one that I wanted to talk to you guys about. Was there's a big controversy, or has been in the past, with kind of, do I stretch before, do I stretch after, how do I get ready to play, how do I get ready to run? So especially, I know a lot of people just start jogging or surfing. It's really common. You maybe do a light jog down the hill and jump in the water, right?
Yeah.
Cold water, cold muscles.
Yeah.
Gonna feel tight and sore afterwards, and you're just asking to have an injury. So what a lot of the research is saying nowadays, and what I tell my patients, is really to do kind of a dynamic exercise beforehand. Some of the research shows that as you do that kind of static stretching, you can actually lose some of that springiness and that muscle that gives you your power.
Really?
Yeah, so like jumping with volleyball and stuff, you do a lot of running. They do a big one where if you're really stretching everything out, you lose some of that elasticity.
Oh, interesting.
So some of that spring or that bounce in your step.
I didn't even know that.
Now you know.
Now I know.
Good
So a lot of dynamic stuff, like doing, especially I was talking to our other chiropractor, Dr. David, today, and he was saying, you know, anytime someone's sitting for 1 to 2 hours, you're continually shortening your hip flexors, and then you go and you jog, and then you're rapidly stretching it. You're asking to pull the psoas muscle to kind of tear your hip flexors. It's really common to do that. I see it a lot in runners. So it's just kind of thing that he said that he does is actually doing kind of reverse lunges. So when you're standing there just doing 5 or 6 reverse lunges on each side, and that really loosens that hip flexor up. It starts to turn on those muscles, it warms the tissue up, it gets you ready to go run, it gets you ready to go play, whether it's swimming, surfing, volleyball, basketball, whatever you do. You know, our lifestyle is sitting, so we have to kind of counteract and balance that out. Another one I really like to do is just kind of knees to your chest as you're walking, kind of pull each knee to your chest. You can kind of do figure 8s with your knees, just kind of loosen and warm all of those joints up. But you necessarily don't have to do that large static stretch beforehand. But what it is good is to do that after you work out, after you play sports, is to do that static stretch, loosen everything up, just get elasticity in those muscles so then they don't tighten up and kind of clamp down on you. That's really like what I see is kind of the best, what a lot of the research is showing nowadays, is really do that dynamic first, warm the tissue up, get you ready to play, and then stretch afterwards. So that's that.
Awesome.
Yeah. And so that's a good tip. What I really, a lot of people kind of ask to balance, like, well, what do I eat the day of? Like, how do I train? What should I be eating? And that's really kind of goes all over the board. We do a lot of encourage people to do kind of ketogenic diets in the office, which is really kind of, I'm sure Dr. Gary, I think, has talked about this in the past or on one of these talks, and it's just really burning the fat instead of the carbs. Oh man, look at that.
You get jerk chicken tacos?
El Pastor. Yeah.
That's like next level.
Yeah, not a
I got you a
keto.
little sweet spicy sauce and then a verde sauce.
Perfect. Oh man, looks great.
Oh, yes.
This is perfect. Yeah. So one of the one thing with the keto, which is great, is it kind of burns all your fat. But as far as if you're being a performance athlete, a lot of the research does show you do need some carbs. So it just kind of depends on what your diet is. If you're doing keto, don't start eating tons of carbs and carb loading. It's going to be horrible for you. You're going to feel bloated. You're going to feel tired. You're going to feel fatigued. But kind of that if you are doing a competition, there is one thing that if you eat a lot of fat on that day, it tends to take longer to digest that fat. So that's where you might get some cramps if you're running. So kind of eat a lighter meal. Usually takes 2 to 3 hours to kind of get that through your system. If you're eating a light snack, you could do it half an hour before you play, just enough so you don't cramp up, but it gives you some fuel. So yeah, I'm gonna take a quick bite here. This looks amazing.
Yes, so good. I think that's really good to know because there is a lot of, questions about like, okay, what should I eat? What's the best thing for me? And
Yeah, and I mean, it's mainly eat what you've been eating. Don't try to change things up right away. If you've been eating ketogenic, you've been eating a certain way, eat that way before. Don't Change things overnight, or because your body's going to take a while to get accustomed to it.
yeah, that's good.
So, no food? Oh, I expect. So I wanted to also just talk a little bit about what happens when you do get an injury. Like Raya said,
Yeah.
it's going to happen.
Yeah.
You guys are pushing the envelope. You're pushing yourselves. Something's going to happen. You're
Mountain
gonna roll.
biking,
Yeah.
surfing, basketball, soccer, running,
Yeah, you name it.
CrossFit. Our friend Lamar just like totally blew out his Achilles doing CrossFit, doing like box jumps. He was like jumping up and then something just like ruptured.
Yeah.
And now he's like in a full little boot and
Wow.
sucks. I was
Yeah,
like,
it
what?
sucks,
Like,
but-
dang it.
It's part of the life, as you know, as an athlete. You go through injuries, you rehab them, you recover them, and then you do the right things so that you don't injure that same area again. Like with my ankles, what happened is it was a weak spot. tore ligaments, and then it healed with scar tissue. And scar tissue is not like normal tissue. It's really fibrous, it's really brittle, it's contractile over time, and it's weak. It doesn't stretch. So what would happen is I would roll my ankle, and that same area that was torn would tear again, and I'd do it again and again until I learned to actually stabilize the muscles around the ankle to support that area. And actually what we do in the office is Graston, which in muscle work, deep muscle work in that area. Some of you guys have probably had some Graston done. It can be a little intense, but what it does is it breaks up that scar tissue. When that scar tissue gets laid down, it just goes any which way. The body just goes, oh my gosh, we're injured. Let's fuse this area down. Let's write it off. But we know that's not right. Normal tissue is nice and fluid and all moves in one direction. So when you have one of those injuries, those tears, you got to get in there after it heals and break all that haphazard scar tissue up so the tissue's moving in a nice fluid direction again. Increases pliability in there, makes it so it can stretch a little bit more, doesn't make it a weak spot where you're going to injure it again. So that's really like in the office when we see these injuries after they've started to heal. It will alter other muscle groups, it will alter joints so they're not moving the same because that scar tissue is just kind of locking and fusing it down. So really just doing that post work is so important. You might feel, I'm healed 3 to 5 days. Usually you got swelling and inflammation. It's like, okay, I'm sore, I'm stiff, I'm aching, nothing was majorly torn or broken or bleeding. I feel okay, I'm gonna get back to it. But what most people don't know is 3 months after that, scar tissue is being laid down in that area. So if you don't keep that area moving, if you don't do work on that area, it's gonna start to be a fix. That area's gonna stop kind of moving, the body's gonna kind of write it off. So you really gotta get in there and just be proactive about it. It's usually the symptoms go away pretty quick, which is great. But you really, if you want to be that top level that your body can be, you got to get in there and do the work.
Wow.
Yeah. Talking about like ACLs and any injuries like that. One topic I wanted to just touch on was like the ice heat debate. When do I do this, doc? When do I ice it? When do I heat it? I'm sore, my muscles, or I tore an Achilles. What do I tore my ACL? What do I do? Really like what I look at is I tend to use ice when it's what we call acute, which is really it's inflamed, it's hot, it's swollen. You can like visibly see swelling in the area. You see like the redness. That's when you want to put ice on it. That kind of helps calm down that inflammation, calm down that swelling. And then what I want to usually use heat for is like, my muscle soreness. It's like, we all know that next couple days out, oh yeah, I'm sore from working out. It's like that delayed muscle onset soreness. Or like I've been sitting all day, my lower back's tight and my neck's tight. Heat works really good there to kind of relax those muscles. It kind of turns the pain signal down a little bit, turns the nerves down a little bit. It just kind of just helps you feel better and just relaxes those muscle groups quite a bit. But what I really see is like the bottom line is how your body responds. If you're cold, don't put ice on. It's not going to do well. You're going to tighten up. If you're sweating and it's 80 degrees out on a summer day, heat's probably not going to be what you want. So it's really what your body wants, what you're feeling at that time.
No problem.
That's going to be the best for you, and that's what I encourage people to do is if you know, oh yeah, I put ice on it, it just like tightens everything up. Don't do ice, do heat. That's what your body wants. You got to listen to your body is, I think, the core behind everything.
What time do you think you'll arrive?
Totally.
Well, Jordan's got some beautiful food right there.
Yeah,
So
take a little bite.
we're gonna let him get after that, but in a couple weeks we're gonna be doing actually a sports kind of event, a workshop where we're gonna actually be getting into the depths in detail, the nuts and bolts of like injury prevention, kind of really talking about that whole area of like of medicine and how to do it in a way that you can really apply and what those steps look like. If you've been injured, it'll be a great workshop to attend to because you can find out how to rehab from those things. So that'll be in a couple weeks. I'm not sure exactly the date, but be looking for an email for that or some updates on Facebook and social media. So we thank you guys for joining us today. Dr. J, thanks for being on. Thanks for sharing.
Yeah, of course. Thank you guys for having
extensive
me.
knowledge, dude.
Yeah.
Hope you guys benefited from that and that it was valuable because I know it was. I learned some good stuff. So
Sure.
Ari learned some good stuff.
Yeah.
Heck yeah. So thank you guys for being here. We'll see you next Wednesday. Or tonight, we're actually having a weight loss event at Health and Balance. Genetic weight loss, which is going to be awesome. You've probably seen a whole bunch of stuff we've been posting about that. So if you're free tonight, come and join us then. Or
6:30, right?
6:30.
In our upper medical suite.
6:30, our upper medical suite, Suite G. Next week we have stem cells, and then 2 weeks after that, I think we have the sports one. So
so we'll dive
tons
deeper.
of fun, super summer series of workshops and events and all sorts of good stuff. So we look forward to seeing you guys there. So we'll see you next time.
Awesome.
Yeah, see you next time, guys. Thanks.